Good evening and welcome to RFL. I'm Richard French. Well, what a week. We end a week like no other with more things that are frankly unprecedented in this country than I can ever remember. The governors of two of the largest states in the union, New York and California, now telling their residents to stay home and not to leave the house unless it's absolutely necessary. I can now report that Illinois and Connecticut have just announced the same thing, and other states like New Jersey are expected to soon follow. Desperate times. They are calling for desperate measures as coronavirus continues to spread and spread fast. Tonight, we're going to do something that I think, if successful, will be a regular staple of this program. This epidemic is impacting all of us, and geography is quickly becoming irrelevant here. So we're all going through this, so let's talk to one another. We open up our phone lines, and we'll do so throughout the hour. In fact, the lines, they're already open. The question's straightforward. How concerned are you about COVID-19? You see the number right there, toll-free number 888-766-2428. It also spells out on your phone, 888-RNN-CHAT. Call, we'll take the best calls, we'll put them right on the air. And if you'd rather email us to make your comments online, the address also at your screen, rfl@rnntv.com. Send us a message or a question, and we can do our best efforts to read it on the air. Now, before we get to all your reaction and our guests, I want to give you some of the latest numbers. Right now, in the United States, we have about 17,000 confirmed cases and 230 Americans have died. To give you an idea of how fast this is growing, just yesterday, there were 11,000 people who tested positive. Around the world, there are now more than 250,000 people who have tested positive for the virus, and at least 11,000 have died. COVID-19, it is growing across the globe as the number of cases and the deaths continue to spike. Washington, it is scrambling to deal with the health crisis and also dealing with the financial one that is going side by side with it, the millions of people that are losing their jobs. Today, a major development for individual taxpayers and employers. President Trump announcing his administration is moving tax day from April 15th to July 15th, allowing additional time for businesses and individuals to file their taxes and make payments without interest or penalties.
Hopefully by that time we'll have people getting back to their lives.
The administration also announcing that student loan payments will be suspended for at least the next 2 months. And with most schools in the country closed, the Education Department will also not enforce standardized test requirements. The president insisting the United States will use whatever tools are at its disposal to mobilize against the virus.
I invoked the Defense Production Act, and last night we put it into gear.
The State Department also warning all Americans not to travel overseas.
This means that all international travel from U.S. citizens should be avoided.
This as the number of Americans seeking unemployment benefits is skyrocketing. Take Pennsylvania. They've received approximately 121,000 online claims for unemployment compensation benefits since just Monday. Michigan seeing an average of 550% increase in claims compared to what it would normally see this time of year. Senate Republicans and Democrats are still working with the White House to hammer out a more than $1 trillion stimulus plan to put money in people's pockets, rescue hard-hit industries, and boost the economy.
We're not talking about a $1,000 check. We're talking about much more than that.
The Senate expecting to work through the weekend to have a stimulus bill up for a final vote Monday. Senate Minority Leader Chuck Schumer today saying he's spoken with the president about the bill and he's open to Democrats' key components.
The president explicitly told me he would oppose companies using bailout money on buybacks, even though such a prohibition is not in McConnell's bill. I told the president we need to come together and cooperate in this time of national crisis. He agreed.
Now, another huge issue, that's the shortage of hospital beds, equipment, protective gear like masks, and even doctors, as well as nurses on the front line, given the rate of infection for those so close to the virus. Many hospitals, they have set up tents and temporary facilities to isolate the infected and also to deal with the surge in patients that are already arriving. Masks, another huge issue. Things have gotten so bad. The CDC just yesterday saying that workers who can't get masks can use bandanas or scarves as a last resort. Then, of course, there's the ventilators. It is a huge concern that just about every medical facility has been screaming from the rooftops that they don't have enough. But articulate especially well in New York by none other than the governor, Andrew Cuomo.
I believe the Army Corps of Engineers and the state working together can create more beds. The beds do me very little good without the ventilator. Just for context, where we are, we have about 5,000 or 6,000 secured. We need 30,000. Federal government has 12. I mean, this is a bad situation.
So governors clearly need help. The states are not equipped on their own to deal with the volume of patients that are coming in here for something we haven't seen in over 100 years. So they look to Washington for help. I want you to take a listen to what the president had to say about the role that he saw of the federal government.
First of all, governors are supposed to be doing a lot of this work, and they are doing a lot of this work. The federal government's not supposed to be out there buying vast amounts of items and then shipping. You know, we're not a shipping clerk.
Not a shipping clerk. All right, I want to bring in our guest, Andy Slavitt. He was the head of both Medicare and Medicaid during the prior administration. Andy, I first want to start with the drumbeat I'm hearing from ER docs, docs in the ICU, RNs, hospital leaders about the tidal wave that is coming. They see it coming right now. They've been begging for help for a while, but they're trying to get someone's attention. This isn't just because, you know, they want to have stuff in the reserve. They're probably just days away, right? In terms of, let alone a week away, in terms of not being able to have the supply to meet the demand.
Thanks for having me on, Richard. And thanks to all of the frontline medical workers and first responders. We are truly in your debt, and we need to solve this problem. You know, the premise of your question is exactly right. We have, if you watch the news about what's happening in Italy, we are about 10 to 12 days behind Italy in terms of what's hitting us. So if you want to know what's going to happen here, think back 12 days ago and look at what was happening there, and it's going to be pretty close. It'll be different in each city, but it's going to be pretty close. So this is not an effort that's going to get easier because we're not used to thinking we're used to thinking of things in linear growth terms. Things just kind of grow steadily. That's not what's happening here. What's happening here is we're seeing tests diagnosis of COVID-19 double, I should say, every 3 days. So as bad as it is today, in 3 days, it will be twice as much patient volume. So the frontline doctors and nurses are going to only have to do the best that they can. They're not going to be able to do a perfect job. We are going to have to do the best we can to support them, and that means kicking the gear, stopping the dawdling, and organizing and getting folks the equipment they need. And I would say one more thing before I put it back to you is, if you are a dentist or a painter or a construction worker and you have masks in your possession, bring them to the local hospital, bring them to the local nursing home, bring them to the local clinic.
To that end, I know you're familiar with the study by the UK epidemiologists who charted out a couple different scenarios as to, on one side, trying to slow or mitigate it versus to just universally quarantine. Think about what we've seen in the last 36 hours. You've got California, New York, now Illinois just doing it. My question is, and you've forgotten more about this than I have, there's an inevitability that we're going to nationally quarantine. Why are we waiting? Don't we just need to have been there already, that we're just, as I said, just postponing the inevitable?
Well, there is a good reason to wait, but you're in certain places. And the reason is we're a big geographic country, and things won't hit us all at once and all at the same time. So, you know, there may be parts of the country where this gets where what New York is going through today and what California is going through today don't happen for a few weeks. And so I think what's really important is that there's a lot of coordination, a lot of local information, and people pull the trigger at the exact right time. So I think it's okay for there to be a little bit of that. There should be a lot more coordination, a lot more strategy, a lot more of a plan from the federal government and the governors working together. But I think it's really the governor, advised by their health official, are going to be in the best position to know. Now, if I were working in the federal government and I felt like there were states that were not doing the right things, that were not taking the prospective actions that New York and California were, I would take them for them. I think that's what, and I hope that the current administration will reach that far and do that. So far, they have not been as decisive as I would like to see.
I know right now our priority is just to get the assets needed and treat the people as efficiently as possible, but I worry that there could be, some kind of an overhang or concern where people won't go in for help because they're afraid of the bill they're going to get. You're probably the best person to answer this. Is that some outlier? Is there a real possibility people are going to get stuck with huge tabs if they try and seek care?
If you have COVID-19, put yourself in isolation for 14 days, or if you have a fever. Number two, if you then have difficulty breathing or you get concerned, call your doctor, and then of course you go to the hospital, go to the ER. Congress is working on a package now, and they will have a feeling this is just the beginning. They passed two things. They're working on a third. I expect there will be a series over time, and I think we can assume and we can push for the fact that they are going to have to take care of this, because people will not, and people should not worry about getting stuck with the bill. That there will be some, whether it's in this package or the next. So I'd ask people, if you do need the treatment, to go get it. Now, the organization that I chair, United States of Care, which is at usofcare.com or .org. It's a private. We put out a comprehensive 5-point plan today to the Congress and tried to anticipate every issue we could possibly anticipate at this point of what we think they need to do to protect people, protect frontline workers, protect people who are in vulnerable communities, get the infrastructure in this country moving again. And so if you want to see what those things are, you can go to you can either go to my Twitter account or you can go to the US of Care website, and because we do think it's an issue that we need to make sure is addressed.
And we've put up that URL for our audience. Finally, there'll be time for recriminations later, but I don't know if you got to see it, but the president today and how he chose to use his time, the messaging that there's some cure right around the corner, or we got a vaccine ready to basically hand out, or that we've got all the masks we need that are ready to be shipped and delivered. Wouldn't we be better off if it was just Dr. Fauci just giving the straight, factual, scientific evidence right now and the status? I'm really concerned about the mixed messaging, and you hear some people parrot it that, hey, everything's going to be just fine here, where people aren't absorbing the gravity of what's in front of us.
Yeah, as long as they did it kept Dr. Fauci in a different room, I would really prefer that. So we don't need him getting sick. But look, I think the governors, by and large, are doing a terrific job telling the truth to the constituents in their state, not spinning anything, preparing for the worst. The president, who is, I think, has come some distance from his pie in the sky, rosy scenarios, because it's impossible for him to ignore. And in a way, I think he can't help himself but to spin to the positive, to search for the good news. I think that's the kind of person he is. I think we know that. He's not the kind of person that likes bad news. He's not the kind of person that wants to accept responsibility. And I say this not as a political bash. I'm very much on the president's side. If he wants to do the same thing I want to do, which is save lives. So this is not bashing. This is, in a sense, making the point I think you made, which is very important, which is people need to know what they can rely on. And when Trump says that this is going to be over in June or July or August, it's not true. There's not a scientist that will tell you that's true. Now, if we got some break or we found something great happened, and let's be wrong on the more cautious side. But when I was running big organizations and running the healthcare system in the U.S., I would constantly ask people, what am I missing? What could go wrong? What aren't I seeing? What's difficult? And if someone brought me good news, I would be very, very skeptical. And I would want to make that skepticism the case until it was proven out. And I think that's the best way to govern right now, because if we make assumptions on hope, it hasn't worked so far.
Andy, I appreciate a few minutes with you tonight. Thank you so much.
Thank you.
All right, everyone. When we come back from this quick break, we turn the program over to you. I'm going to bring Andrew Whitman into us, and we're going to make you a part of it as well. You see the toll-free number right there. I just want to know what you're going through. Maybe you have a personal story, maybe just your state of mind, what you're concerned most about. Here are questions you may have. We're going to have a conversation. It begins right after this.
These things we saw in 1918, the cities that acted quickly were able to protect more people, and those that didn't were devastated.